Hello, Dr. Keith Smith on behalf of the Free Market Medical Association and coming to you from Surgery Center of Oklahoma. Thank you for joining us in this video blog series. I'd like to talk today a little bit about a new three-letter combination in the healthcare industry, the ACO, the Accountable Care Organization. First, though, I think we need to talk a little bit about the background and the history of pricing in healthcare. And to keep things simple, I'll just talk about physician pricing. Prior to Medicare's enactment, doctors knew what they were going to charge, and they told patients what they were going to charge, and they told them up front. When Medicare came along, because so many physicians wanted no part of this socialization of healthcare, they were very reluctant to go along with Medicare. So to entice the physicians to get on board, the old folks at the federal government do what they always do. They bribe, basically. And they enticed the doctors by doing this. They said, whatever you charge, we'll pay it. Well, the doctors didn't last very long. They went right along with Medicare. That just sounded like a great idea to them. And you can imagine what happened to what physicians charged after they received that guarantee. This, of course, is a disaster and is now a bankrupt program. And it's done exactly what you would think. In order to not be bankrupt immediately, they've responded with rationing and price controls, and the whole thing is just a corrupt, bureaucratic mess. Medicare began really clamping down and rationing in the early 90s, and oftentimes people will follow Medicare's lead, and so we saw these new three-letter combinations coming along. First it was the preferred provider organizations, and then it was the health maintenance organizations, the HMOs. The HMOs deserve a little bit of a comment because they figured out that they could actually ration care and get away with it. The PPOs were a model that really didn't bring the physicians in on the savings when care was denied to the patients. The HMOs were huge money makers because they figured out that if they could actually pay the doctors a bonus to the extent that they could deny or delay care, that would bring the physicians in on the joke. The patient would be completely disenfranchised, but the doctors would make more money if they served as effective gatekeepers and kept people from receiving the care that they needed, or at least delayed it. This HMO model originated in Germany, and that's really no surprise. It's been a disaster everywhere that it's been tried because it relies on two types of rationing that I'll call soft rationing and hard rationing. Hard rationing is not covered by the plan, and we're simply not going to pay for that. Soft rationing is, well, that's covered by the plan, but we're not going to say no. We're just going to say not now. So you begin to see these 2, 3, 4, 5-year waiting lists for things that people need when they realize there really isn't covered. They're just being told with the variable of time that they're going to pay with their time. Well, ACOs, Accountable Care Organizations, it's the same theory. They have soft and they have hard denials. They have denials that are no, and then they have delays. Basically, the ACOs, just like the HMOs, and this is very important because you're going to hear a lot about these accountable care organizations and how wonderful they are. They're the same business model. Physicians are paid more to the extent that the health plans are spared expense. So physicians actually are incentivized to deny or delay the care that patients get. This is a horrible business model. It takes the physician to a place where he cannot possibly be the unapologetic advocate for his patient. So when you hear about the ACOs and how they're going to save healthcare and they're going to save us all this money, understand that it is this soft and hard rationing where the physician has been co-opted and is being basically paid a commission to the extent that care is denied or delayed. Thank you for joining us in this video blog series. I wanted you to understand the importance of these new three-letter organizations. We'll see you next time.